My name is Robbie Gluckson. In my role as Director of Marketing and Community Outreach for UCLA Health's Department of Medicine, I have the honor of working closely with community leaders right here in Simi Valley, educators in Westlake Village, nonprofits in Thousand Oaks, and volunteers throughout the entire community. It is our goal at UCLA Health to engage and empower what I call an extraordinarily close-knit community. This community deeply values the health and wellness of its residents. We believe health and education go hand in hand. Tonight is an opportunity for all of us to learn more about the science of cancer research in tandem with the art of medicine, all taking place here in our local, vibrant community. Webster defines the word demystifying as follows: to make something clear and easy to understand, to explain something so that it no longer confuses or mystifies someone. I believe this quote that you'll see on the screens from Marie Curie perhaps says it's best. We hope after tonight's dialogue, you will walk away demystified about cancer and empowered with the knowledge that great breakthroughs are truly within reach. Before I introduce our moderator, there's one quote I wanted to share with you that I think really sums up tonight. It was from the founder of X Prize, an amazing organization, and it goes like this: the day before something is a breakthrough, it's a crazy idea. Leading us through this evening is our moderator, the award-winning journalist Jim Rondo. Jim is the Director of Operations and Programming at KCLU radio station. His commanding voice will be familiar to many in the audience, as he is best known for anchoring Morning Edition and hosting the celebrated public affairs program Crosstalk. Jim's work has been honored by major journalistic organizations, too many to mention, by the way, Jim. And most recently, he was honored by the LA Press Club as Best Radio Anchor in Southern California. Please join me in welcoming Jim to our stage.
Thank you so much, Robbie. I do appreciate the introduction, and it's great to be with you here tonight. Nice to see so many people out who are not Red Sox or Cards fans. Looks like it's going to be a good night in Boston, though, the way things are going. Anyone who's ever had in their family or heard the words personally, you have cancer, you know the shock that can go through you at that moment, the way that nothing that felt sure 5 minutes ago is something that you can be certain about at that point. But that's all changing, and that's what's so exciting about being here tonight. We have a very special panel that's going to bring together all of the exciting research that's going on in the world of cancer. We'd like to acknowledge UCLA health leadership and faculty. Many of them are joining us this evening, along with our guest speakers and panelists. And most importantly, we want to thank each of you in the audience, some of whom have submitted questions that we will be getting to tonight. We have all kinds of different topics we want to cover, and we're going to step through a lot of information in the next little bit. So we do want to ask that if you have a cell phone with you, make sure you turn it on vibrate so only you get the call and not everybody else does. We don't want you to get the evil eye from the panel or from Robbie. But other than that, it is great to have you and your cell phone here with us tonight. Our keynote speaker is Dr. Dennis Slayman, a world-renowned cancer scientist and clinician. He's won many international awards for groundbreaking research in the area of breast cancer treatment. Dr. Slayman and his colleagues conducted 12 years of research that led to the development of the breast cancer drug Herceptin, which you may have heard of. Herceptin was the first of many new treatments that attempt to fix what's actually broken inside of a cancer cell. That work marked a seismic shift from sort of a one-size-fits-all approach to killing the tumor onto a study of the actual genetics of specific cancers. Dr. Slayman is director of the Revlon UCLA Women's Cancer Research Program at UCLA's Johnson Cancer Center. He's also professor of medicine at the David Geffen School of Medicine at UCLA, chief of the Division of Hematology Oncology, and executive vice chair for research for the Department of Medicine. And we could go on, but we'd be here all night. Dr. Slayman was also recently named a 2013 Thomson Reuters Citation Laureate in their prestigious annual Pre-Nobel Prize study. So with that, ladies and gentlemen, please welcome Dr. Dennis Slayman.
Thank you, Jim. I would like to start by acknowledging the incredible work that Robbie's done with her team in putting this together and getting the word out and getting you here. I would like to, secondly, thank you all for spending an evening with us. I know how precious private time is, especially with Game 6 of the World Series going on. And I also want to acknowledge a colleague of mine at UCLA who's been working very actively with building a liaison between the university campus, and the communities, Dr. Matt Donalfo, who is here with us tonight and has been leading our whole effort in primary care and subspecialty medicine in the communities. The objective that UCLA had when this started was to be able to set up a situation where patients no longer needed to drive to Westwood. Actually, I'd prefer not to have to drive to Westwood. I live in the San Fernando Valley, and the 405 can sometimes be challenging. And in order to be able to do that, the critical thing would be having really outstanding facilities in the community, and you do, and having outstanding subspecialists that we in cancer care need, and you have that as well. You will hear from a couple of them tonight, physicians who are not on the UCLA staff, but are really outstanding physicians in the community, and I'll introduce them directly. What we want to do tonight, before I introduce the panel, is really what Robbie said, demystify some of the thoughts about this disease. It's a disease that certainly strikes fear and terror when a diagnosis is made, but that may not necessarily have to be the case the majority of time. In fact, more than half of patients who are diagnosed with a malignancy are cured of their disease, never to have any problem with it ever again. So we need to focus on those patients where a challenge with the disease recurs, and we have to deal with that. And that's what we'll be talking about during the course of the evening. But before I go any further, I want to introduce our really illustrious panel. You've heard from Jim, you've heard from Robbie. I'd like to introduce Dr. John Glaspie. John is the Associate Chief for our Division of Hematology Oncology at UCLA. Division simply means in a Department of Medicine, sort of like it's not good to talk about the government, but there are divisions in the government like the Treasury Department, the Health and Human Services, bad word these days. In medicine, there is cardiology, gastroenterology, endocrinology, and hematology oncology is the group that we represent, and we take care of adults with malignant disease. We have colleagues who do that same function in the pediatric side of the university. But again, the objective of what the Department of Medicine has led for UCLA is really to bring to the community the kinds of things that would make it such that you would not have to come to UCLA to receive some of the quaternary or tertiary care that you otherwise might need to get, or access to some of what we think are cutting-edge clinical trials that we'll tell you about tonight. So Dr. Glaspie is the Associate Chief. He's got an impressive CV on his own, more than 270 research publications, book chapters and abstracts. He has been a leader in identifying how to use growth factors, which you'll hear about tonight during the course of my comments, to make sure that patients can tolerate much better than they previously did the therapies that we use, and not have the problems with infections and problems with the bone marrow. Again, some of his work has been among the leading work in doing that. Also tonight, we have Jody Thompson, who's the Vice President for Planning and for Events for the community service for here, Ventura, and Santa Barbara. And I think it goes without saying that the support systems and the support care systems that cancer patients and their families have access to not only are something that makes their dealing with the diagnosis easier, but there's objective data that show that patients who participate in these things have better outcomes. So there's objective data that that's a good thing to have. She works with an organization that serves more than, this year, 3,000 adults and children and teens with various services, and does this all free of charge for the organization. So we're happy to have her as well. We also have Dr. Victor Schweitzer. Victor, and although he looks quite young, we go way back in the sense that we work with Victor when he first came out of training as a radiation therapist, radiation oncology. He worked with us closely in a Lancaster outreach program and now is working closely with us here in Simi Valley. He is the chair of the cancer committee for the Simi Valley Hospital and director of the Radiation Oncology Treatment Center. Victor's an outstanding radiation oncologist, boarded in this thing, has specialty training in stereotactic or directed radiation therapy to various parts of the body to stop some of the side effects that happens with wider radiation therapy beams, and we're fortunate to be working with Victor. Dr. Anita Call has been in the practice of medical oncology. Is it okay to say, Anita, more than 20 years? I think it's okay to say because she doesn't look like she's been in more than 20 years. More than a dozen of those years have been in the Thousand Oaks community, Thousand Oaks Simi Valley community. She has offices in both areas, and she joined our faculty a few years ago. She is an active participant in bringing to patients new clinical research ideas, clinical research trials, so they have options, as well as really demonstrating the compassionate care, keeping us all focused on the things that are important to patients and their families. In addition, Dr. Craig Inouye, also from the community, he is a board-certified radiologist involved in diagnostic radiology. He directs the Simi Valley Hospital Tumor Board. This is an important organization at all hospitals that have accreditation for taking care of cancer patients, in that multidisciplinary physicians will discuss the case and talk about all the options so that whenever a recommendation is given to the patient, it's given to the patient not just from one physician, but from hopefully the combined wisdom of a number of physicians dealing with the disease. And then last, but by far not least, Dr. Martin Palmer. Martin is also on the faculty at UCLA in practice here in Thousand Oaks and Simi Valley. Martin is a board-certified medical oncologist and came to us, and internal medicine, and came to us through initially from Australia to Canada and then to Southern California. He's been in practice in Southern California for many years now. When in Canada, he was found to be really an outstanding teacher, and the University of Alberta took advantage of that talent and had him as an assistant dean for education, and he was also head of the medical oncology training program that trains people like myself, Dr. Glaspie, the other medical oncologists, in the specialty of medical oncology. So we're also happy to have Dr. Palmer with us on the panel tonight.